Well, as that 13% of Australians still grapple with the choice to take or refuse a COVID vaccination, I thought it might be instructive tonight to hear from someone who's dealt with the virus on the front line. Professor Jason Kovacic is from Sydney's Victor Chang Cardiac Research Institute and has worked with COVID patients both here and in New York. He knows what really goes on in our hospitals, and it's ghastly. He also knows that Delta is almost a new virus with deadly consequences for younger people and their heart. He joins me now. Professor, thank you very much for your time.
Thanks for having me on. It's a pleasure.
What's it been like working on the front line in the hospitals you have and with COVID patients and the terrible struggles that they face?
Yeah, I mean, it's harrowing, I think, is about the only word that comes to mind. And I was fortunate to leave New York City. I came from the Icahn School of Medicine at Mount Sinai in Manhattan and took up the job at the Victor Chang Cardiac Research Institute in the middle of March 2020. So I left behind a practice of about 1,000 patients in New York and handed them off to my colleagues, but we're still very close to a lot of them. And I was unfortunately involved in the demise of multiple of those patients of mine. And as I still knew the families quite well, was dealing with the families and so on, it was awful. And then now I'm a cardiologist at St Vincent's Hospital here in Darlinghurst in Sydney and doing cardiology call and seeing COVID patients on the cardiology service. And it is harrowing. You know, it's just hard to describe the situation with these sick patients on ventilators. Family can't see them, doing, you know, family conferences on a Zoom meeting, things like that. It's really something that you want to avoid.
Yeah, death is never pretty, but the way in which these people end up dying, separated from those that they love, and then being unable to breathe must be just horrific to watch.
Yeah, I think there was one patient in particular of mine in New York City that was in intensive care for about 2 weeks, basically dying slowly over that time, and eventually succumbed. And I was talking to his wife. I'd known them both for about 7 or 8 years, talking to his wife on a daily basis. She couldn't get in to see him and was sort of seeing him on Zoom meetings, and he was unconscious on a ventilator. It was just awful. And then there's the other end of the spectrum. I think we heard in India recently when they were having trouble with oxygen supplies, and someone used the metaphor of it was like watching a whole bunch of fish out of water just flopping around, gasping, trying to breathe without oxygen. It was just horrible scenes.
And now that you're back here and you're seeing what's happening at the hands of Delta, tell me what unvaccinated victims of this disease relate to you. How do they communicate whether they should have got a vaccination or not?
Yeah, sure. It's always a very, very sad story when someone says, oh, I wish I'd had the vaccination, or I should have listened, or I should have got it, and they wind up sick or, you know, with organ dysfunction, or worse still, some of them die. I thankfully haven't been involved in anyone who's died and should have got a vaccine, but I have been involved with patients who have succumbed. It's tragic, and it's a tragic situation in medicine. Whenever someone should have had some sort of intervention, they choose not to have it, and then they succumb to it. It's particularly distressing in COVID because there is an option now.
Okay, we'll get to that option in just a second and what your message is for those who are still deciding. But I want to ask you about children. We've got a group of children in Brisbane who have succumbed to this. We've got, I think, 4 people in New South Wales in their 20s in hospital. What are your greatest concerns about the Delta variant and their hearts?
Well, the COVID can affect the heart in multiple different ways, and it's very clear that the Delta variant does attack younger people far more than the earlier Alpha variant we were seeing. And obviously there's more young people in ICUs in New South Wales and Australia now than there were in the beginning of the COVID-19 outbreak, and they're getting sicker. And as we saw in New South Wales, there was a very unfortunate man who died suddenly from COVID-19 complications, and it's quite possible he died from cardiovascular complications. COVID can affect the heart by causing heart inflammation. It's a condition called myocarditis, and that can be both a direct viral infection or indirect due to that cytokine storm, that really ramped up inflammatory situation we know that happens with COVID. It can also cause heart failure where the pump doesn't pump as well as it should. It can cause heart attack, heart rhythm problems, and also can cause blood clots either to the lungs or to the heart arteries. So multiple different ways that COVID can cause demise through the heart.
What's your message then, given what we know about Delta? What's your message then, who are in that 13% of Australians who are dissenting about taking a vaccine?
Look, I understand that there's been confusion in the rollout and mixed messaging and social media, lots of discussion, but I think the data is really clear. I mean, it's over 4 million people worldwide are now dead from COVID-19. And the safety of these vaccines is really high. Yes, they do have very, 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 very rare complication rates, but those rates are far, far eclipsed by the active deaths. And we're hearing deaths every day now in New South Wales. I think that the data is very, very clear that you are far, far better off being vaccinated than unvaccinated and taking your chances. I couldn't believe there's a more compelling case to get vaccinated than there is with COVID-19.
Professor Kovacic, thank you very much for your time this evening.
Thank you, Chris. It's a pleasure.